let's have a quick orientation and what exactly is MICE Labs, what exactly is the term that is known as medical innovation, and what exactly it means, and how does it impact our lives, what kind of things can we do as medical students, and where can we play an active role. There we'll be discussing about all these things, and of course at the end we'll have question answers. So let's get started. uh, so MICE Labs is basically, we are a innovation lab based at JJ Hospital, Mumbai, and we are functioning very well with a 1,000 square feet area, and with the all state of art facilities like 3D printing, robotics, electronics, and virtual reality. Uh, we're trying to educate medical students all over India. So even though putting our base in JJ, we're trying to reach out, and through organizations like Medicrew, we're trying to establish networks and educate students more and more about what is the concept of innovation and entrepreneurship, and how students can benefit from this particular concept as even one of their career options. Okay, so just before getting into the technicalities and what exactly these things, let us understand the first basics, that what exactly is innovation. Now, many times we've heard this term, and many times what happens is we don't know the definition, or we tend to speculate. But what exactly happens is, when you understand the definition, before getting into it, and when you actually focus upon the definition's principle, that helps you to remember it. That is number one. That also helps you to understand the main aim, what exactly you're doing, this innovation you're doing is meant for. Okay, so of course it's not a bookish or a difficult definition that you need to always strain your mind, but there's a key word in the innovation that is marked in red. If you can see, it's any idea. If you want to translate any kind of an idea or an invention, or a good or a service that creates value, whatever thing that creates value for your customers or for your users, the people, whoever you are intending to do this. For example, in terms of you guys, it would be doctors, healthcare, medical staff, and patients. All these people are your customers, who will who will get a kind of a value that you create for them. That is basically called as innovation. And value means not just about money, but it's also about how they get benefited out of it, because it's solving one of their problems, right? So therefore the definition goes, the process of translating an idea or an invention into a good or service that creates value for which your customers are willing to pay. And there's one important and essential property which you need to know, that innovation means it should be cost effective, and it should be replicable. So these two properties are there, whether if you want to term that particular thing as an innovation. Okay, so now let's understand these by let's break down this particular terminology and understand what exactly is this innovation. So and I think a lot of people also have that confusion, that if I've heard innovation, I've heard invention, what's the term difference, right? English language has a lot of these terms. So what is the difference that comes between innovation and invention? So this is the basic invention. The difference point, or the differentiating factor that we add over here, is that commercialization factor. Invent, you go out, you find out a problem, you develop a, you do a hypothesis, and you come out with a solution. You do a research, and you bring and develop a product, a device, a service, whatever it may be. But if that thing is commercially replicable, if you're able to develop that thing as a product or as a service, and something which you can commercialize it with having that commercial value, where your customers are going to start getting benefited out of it. It is not just going to remain with you, it is going to go outside, and it is going to create an impact in the world. And that's the basic thing between invention and innovation. And if I combine inventions with commercialization, that is basically called, that's nothing but an innovation. Okay, so I hope this terminology becomes very clear to all of you, and let us understand these things by simple examples. So the if you can see these kind of these all these images on the screen, every object on the screen is a kind of an innovation in itself, right? For example, if you see the Lego blocks, it's a very interesting story, how Lego blocks started. You should sometime, there is a Lego blocks channel. There's a Lego company's channel on which they have made a small 15-minute short film on how Lego started its journey from making those blocks. So anytime you can go to YouTube, you should read, and you should go through that short film. It's a really amazing impact that it shows, that how Lego blocks started from its this thing. So the father saw his son playing with bricks. So he thought, and he saw that the bricks don't grip to each other. Sometimes it tends to fall. So he thought, okay, why don't I create grips like thing which can, my son can play using these bricks well. And that's how he started using wood to, in the initial stages, he started using wooden toys to carve, and then make that in those shapes where you can start putting bricks on top of each other. Slowly those things start evolving, and then it started becoming that using plastic molding, they started making plastic molds out of it and started building Lego bricks. And today we see Lego is a huge company that is selling lot of toys. And now they're observing the environmental degradation factors. They have also seen that how can we create recyclable plastic for these kind of bricks, right? So this is one of the stories of Lego. Then we all know about the service industry. Restaurants were there always, in and around. People would go to restaurants, or people would call to that individual restaurant and do an order. But again, two companies that came into our existence, Zomato and Swiggy, with a lot of innovation mindset, thinking that how can we have customers use this, right? Restaurants तो था हम लोग को मालूम है, but इतने सारे restaurants का chain बना के, and you can order a variety of food stuff and sitting at your home, and you can get a lot of different kinds of varieties, and with a lot of offers and lot of discounts, coupons, so many things created in just to these kind of startups that have come, Zomato and Swiggy, right? And these companies are very, very huge. They're trying to build connecting the customer to a lot of chain of restaurants, right? Same thing, we come with Uber and Ola. Uber and Ola, again, a lot of taxis are always available, but you never get you never get to interact, or anytime you want a taxi or an auto rickshaw, or you want to go book a cab, you're not able to have anything. But thanks to Uber and Ola, with those kind of services, they have come that on a mobile phone application, wherever you want to go, you can book your ride in advance, and then you can ride basically to your comfort. And again, a lot of offers, a lot of discounts, a lot of coupons. Uh, you know, Again, then this is one of the initiative that Nestle came in with. If you see Nestle, they identified that people are drinking canned foods, like could be cold coffee, it could be chocolate milkshake, or any kind of drinks, right? Eatables. Uh, Again, it is a problem towards the environment, and a lot of degradation happens. So they replace the entire straws with paper straws, plastic straws. They replaced it with paper straws, and that's how we are able to see how those kind of materials can again become very good for the environment, right? It doesn't harm the environment. Innovation happens even in food industries, and it to a very large extent. So if you all of you love ice creams, I can say that, right? Everybody of us like ice creams. So this was also one of the problems that was seen in many years ago, that whenever people eat ice cream, they throw away those cups here and there, and it causes a lot of littering and a lot of environmental issues again, right? So then people actually said, okay, why don't we create a container in which people can eat the ice cream, and also the container cannot be thrown, they can eat up the container as well. And that's how that idea gave birth to ice cream cones. And today we all enjoy eating ice creams on cones, right? By licking it, we enjoy the taste, and we don't need to throw off the cone. You can have that as well, again causing less damage to the environment, right? So if you see, every kind of example that has been shown over here has different kinds of impacts towards the environment, towards the service, towards building a product, or towards just tweaking smaller changes, right? And these kind of innovations are always existing. uh, okay, but let's talk about something about medical innovations, because all of us over here are here to listen about and learn about what exactly medical industries can innovate into, right? So let's get into the picture and understand that medical colleges basically are, huge places where a lot of knowledge can be gained, by where students can learn from their professors. But unfortunately, what happens is medical students don't get that exposure, who are tech savvy medical students. You don't get that kind of an exposure towards, technology based stuff. If you want to, if you have an eagerness, and you're tech savvy, you have that kind of an inclination towards technology and to experiment. But many times what happens is you don't get that right platform. So medical innovations, basically what happens is you get an opportunity to go talk to your doctors, talk to your professors, and learn many things probably which they couldn't do in the past, right? They couldn't do many kinds of treatments, or they couldn't treat much patients on a larger scale. But how can, tech savvy medical students do the same thing, right? So that gives birth to the concept of medical innovations, and how we can do that. So we see that yes, medical technologies has been making a lot of advancement. We know about EMRs, electronic medical records. We know about a lot of apps and chatbots coming into the picture, Practo being one of them. Is bringing in a lot of software based help for patients, and connecting doctors to patients through digital technologies. Telemedicine, one of the most relevant things during these current times, when patients are not going able to access to their doctors, they are using the help of telemedicine via video calls, or video conferences, and trying to get consultation from the doctors. Virtual reality, augmented reality, 3D imaging. Traditionally medical imaging was very weak, but thanks to virtual reality, augmented reality, and 3D graphic technology that is coming in, which is helping doctors to visualize the patient's body in a much better fashion. रोबोटिक्स, जो काम एक डॉक्टर को कुछ घंटे बिता के करना पड़ता है, robotics is helping, robotics is helping to do that in very few hours. And it is increasing the efficiency of the doctor in terms of surgery, and also in terms of many hospital care, patient care. Genomics, informatics, a lot of information is coming now. Biotechnology is coming. Big data, cloud computing. Nowadays, storage is not no more in those. Previously it was in those floppies. Then came to CDs, CD cassettes, and now it is gone. Then slowly it has gone to a digital thing. You can have a USB stick where you can have a lot of things. But now data storage has gone to the extent of cloud storage. You can access your data from anywhere in the world, with even without a physical device, right? Your data is stored in a cloud server, and you can access it from that. Again, you have 3D printing, bioprinting, organ printing is also coming into into huge research that's happening even in India. And we also know about a lot of sensors and implants that is going in. We know one of the most common thing, that's a pacemaker that helps you to resuscitate and give pulses to your heart to support your heartbeat rhythm of the entire body. Other than that, we also know about Fitbits, wearables, which basically give you a lot of readings about your heart rate, your pulse rate, your oxygen saturation. So many kinds of sensors are coming. Implants, even to the a lot of implants which you can put it under your body, and it gives you a lot of information through that. So we see that medical technology is growing, but sadly, it is not penetrating to even the rural sectors of our healthcare system. You know, sadly, this is what all of you, I think, have seen in your hospitals, in your postings. Working in a government hospital, always you see this kind of load. So much of patient load, frustrated patients, and a lot of chaos, and a lot of people coming here and there, and a lot of uh, uh, you know chaotic situation happening in the hospitals. And unfortunately, whatever these technologies we spoke about is not penetrating to the market, and it is not coming out for these people's help, right? Again, it has its own reasons. For example, it could be cost affordability, it could be even accessibility. How many of these kinds of technologies are actually available at the ground level, right? So the main focus that comes is how can we make these medical devices cost effective, that is affordable, and even accessible, right? Many times these kind of devices exist. World class technologies exist. India has a lot of world class technology, but unfortunately, it is not affordable and accessible to all kinds of sectors. So how can we get that done, right? And to add to on our damages that was already happening in the healthcare system, this new small 10 I think point 0.1 nanometer object has created a huge havoc in the entire world. That is the coronavirus, the COVID-19, caused a huge pandemic for the entire world's lockdown. And this virus is not visible. It is not visible to the even naked eye. You can't even predict how it spreads. Unpredictable transmission, so many lives lost, lot of economical disturbance. So many doctors have faced a lot of issues, exposure to infections, extended duties, long hours in the in the in the isolation wards, and a lot of extra efforts to treat this particular disease. Already हमारे जो देश में diseases है उसकी कमी नहीं थी कि ये this new thing added up and is affecting a lot of people. uh, Again, we also have seen a lot of videos and cases about how patients' relatives also have acted in a different way that is creating harm to the doctors. And we don't have any medicines. Vaccines are yet under discovery. They are trying clinical trials. Phase 3 is going on. Hopefully, we get some success out of it. And of course, the thing is that we also saw a lot of when the initial phase, when the pandemic started, we saw a lot of shortage about ventilators. We didn't have medical infrastructure. We didn't have place to accommodate so many patients. Isolation wards weren't available. Beds weren't available. We didn't have masks. We didn't have patients with. We didn't have things, PPE kits to offer to our caretakers, nurses, and even the doctors who are attending it. And unfortunately, all these things came up all of a sudden, and we couldn't handle these things. But again, thanks to innovations, that we could actually go through a lot of uh, you know uh, brainstorming, and thanks to the kind of resources that we are getting through our country to develop something which can be easily accessible for the patients. And that's how we can see that these kind of innovations that have come to the market, food sanitizer dispenser, then even sanitizing chamber, also about non-contacting sanitizers, without touching, you can just on a motorized level you can do that. Sanitizing boxes, UV light has proven, according to its research, that it has the efficiency to kill 99.9% COVID-19 virus, right? Then also we did something very great jugaad, which was really helpful to extend the use of a ventilator, right? So on the left corner down, if you can see that image, the ventilators of ICU wards which were falling short, they could now, using this kind of a pipe structure, which probably could have been 3D printed and plastic molded, they have started maximizing the use of one ventilator to 3 or 4 more patients, right? So thanks to these kind of innovations that is coming in and saving the healthcare sector. Now let us talk also about are are medical students future ready? Okay, all these innovations are happening, but is there any kind of a curriculum, or is there any kind of a chapter or a subject which you guys learn in your studies, that how to innovate, what are the tools of innovation, right? Unfortunately, no. So how can we get the next generation students or the next generation doctors to also start innovating, right? Because always innovation is coming from engineering or design, or finance sectors, but how about innovation even in the medical sectors, from medical students who are taking that kind of a responsibility to not just treat their patients, but also take care of their patients using these kind of disruptive technologies. But what we also see is that medical students are unfortunately with the old kind of system, where they're stuck with cramming up books, a lot of exams, a lot of assignments. I think you all can relate to this particular scene. Your books, you study a lot of things, a lot of information. You need to be very read a lot for writing your papers, pass them, examinations, practicals, vivas. Oh my God, a lot of them. And we also see about how the lectures have been taken, the lectures to you, there's no change, the same old classrooms, uh, you know everything, everybody sitting hearing to a lecture. But unfortunately, you can't become good doctors by just hearing a lecture. You also need to some practice. And we're seeing that a lot of technologies are coming and disrupting. Digital disruption is happening today in the world, but we don't want our doctors to become digital dinosaurs, or become extinct in that way, because of not upgrading themselves towards the current ongoing scenarios, right? There is no medical curriculum in today's system that is teaching us how to innovate, and how to start your own company, how to bring about entrepreneurship, what kind of technologies are available for you to innovate, right? So that's where we also thought, that we should also penetrate this particular area and start educating our next generation, saying that you need to reinvent our entire medical education system by teaching our next generation the principles of innovation and design, and just not theoretical uh, principles, but also about hands-on practice, right? By teaching them. Yeah. And that's how we thought that how can medical students also start become very very active in terms of use of technology, and to innovate in this to solve problems that are associated in the system, right, in the healthcare system. And how can we improve that using these kind of tools, right? So it could be skills training, it could be use of robotics, it could be use of virtual reality for doing simulative experiments and simulations, to learn about all these things. And to do a virtual surgery even without getting that experience as a student also, you get a chance to do a surgery, right? So the main thing what we understood is that collaboration is the key. Bringing the best of both worlds, from technology and from medical, coming together can actually bring a lot of change. And to innovate and to bring a lot of teaching possibilities, collaboration will make a lot of change. And the thing is that medical students can now start talking to engineers, to start talking to designers, talk to their senior doctors, even talk to your patients, and under one roof, try to come together and work as a team. As I said, collaboration is the key. Because what happens is, uh, you know you as medical students understand your patients much better than what an engineer can understand, right? So therefore what happens is, when these kind of a team is built, an interdisciplinary team where medical students, engineering, finance, humanities, all these people come together, and then work on an innovation that creates a huge impact to the world, right? Because what happens is, always a doctor's and an engineer's thought process is different. And uh, you know the ways and approaches are different. So therefore bringing them together rather than having a competition, bring collaboration so that it can help to create a better impact. Okay. uh, I'm going to show you an image, and I would like to ask you if you can tell what exactly is happening over here. That is the first question. And the second thing is, if you could give a caption to this image, whatever you see on the screen. So it's just how to bring the best of two worlds. The technology, when engineers can repair cars, when doctors can repair human beings, live human beings, they can even work with technology. And I think that's a great fact, right? So bringing best of the both worlds together as a team, and working on these different kinds of innovations to solve problems, right? So now we'll just show why is teamwork essential, and why teamwork brings in a lot of success, right? This is a small story. I think there are different versions of the story. The first version we have all learned in our moral science lessons, the race between a turtle, a rabbit and the turtle, right? We know that the rabbit and the tortoise planned for a race, and we know that because the rabbit was overconfident, it took rest, and the tortoise won the race eventually. But this is what we have all learned in our school days, in our moral science stories. But there are something which is more further, and it's a very, very important principle that has been adapted by all management firms all over the world. So I would request you to please pay attention to this video and understand what they're trying to show by this thing.
Once upon a time, a turtle and a rabbit had an argument about who was faster. They decided to settle the argument with a race. The turtle and the rabbit both agreed on a route and started off the race. The rabbit shot ahead and ran briskly for some time. Then, seeing he was far ahead of the turtle, he thought he'd sit under a tree for some time and relax before continuing the race. He sat under the tree and soon fell asleep. The turtle, plodding on, overtook him and soon finished the race. Emerging as the undisputed champ, the rabbit woke up and realized that he'd lost the race. The moral of the story is that slow and steady wins the race. This is the version of the story that we've all grown up with. But our version of the story continues. The rabbit was disappointed at losing the race, and he did some thinking. He realized that he'd lost the race only because he had been overconfident, careless, and lax. If he had not taken things for granted, there's no way the turtle could have beaten him. So, he challenged the turtle to another race. The turtle agreed. This time, the rabbit went all out and ran without stopping from start to finish. He won by several miles. The moral of the story? Fast and consistent will always beat the slow and steady. It's good to be slow and steady, but it's better to be fast and reliable. But the story doesn't end here. The turtle did some thinking this time and realized that there's no way he can beat the rabbit in a race the way it was currently formatted. He thought for a while and then challenged the rabbit to another race, but on a slightly different route. The rabbit agreed. The turtle and rabbit started off. In keeping with his self-made commitment to be consistently fast, the rabbit took off and ran at top speed until he came to a broad river. The finishing line was a couple of kilometers on the other side of the river. The rabbit sat there, wondering what to do. In the meantime, the turtle trundled along, got into the river, swam to the opposite bank, continued walking, and finished the race. The moral of the story? First, identify your core competency, and then change the playing field to suit your core competency. The story still hasn't ended. The turtle and rabbit by this time had become pretty good friends, and they did some thinking together. Both realized that the last race could have been run much better, So, the turtle and rabbit decided to do the last race again, but to run as a team this time. They started off, and this time the rabbit carried the turtle till the riverbank. There, the turtle took over and swam across with the rabbit on his back. On the opposite bank, the rabbit again carried the turtle, and they reached the finishing line together. Both the turtle and rabbit felt a greater sense of satisfaction than they'd felt earlier. The moral of the story? It's good to be individually brilliant and to have strong core competencies. But unless you're able to work in a team and harness each other's core competencies, you'll always perform below par, because there will always be situations at which you'll do poorly and someone else does well. Teamwork is mainly about situational leadership, letting the person with the relevant core competency for a situation take leadership. And that is the end of the story.
So I think we hear a lot of these kind of a moral that actually teaches us about how teamwork becomes a very important principle for us to, you know, uh, inculcate in our system. And because teamwork can bring in a lot of, benefit when everybody with that kind of a core competency can uh, budge into the system and can bring about an impact there. So it's not that I am less on the engineering side and I don't know what engineering means. That means I can't innovate. No, that's not a problem. You can probably collaborate with an engineer, and you can collaborate with those person with those kind of a skill set, right? And that's how you can work as a team. So I think we all understood now that what exactly is this process, what is this innovation concept about, and why is it so necessary, how is innovation being kind of a helpful. But now how can we as people now understanding that this is innovation, but how can I innovate? Is there a process? Is there some standard methodology? Is there something which I can adapt as tools to use these kind of tools to innovate? And my dear friends, this is our, thanks to the world level organizations which are building these kind of processes and giving us a lot of help on how exactly innovation needs to be done. This is Stanford University's process. Stanford University has started their initiative about 10 years ago or something. It's known as Stanford Biodesign, and they call this the triple I formula: identify, invent, and implement. So you basically do your research in your identify phase. You do a lot of research, ground level research, internet research, literature reviews. All your research happens in the identify phase. You understand where is the pain points. You do interviews with your patients. You do interviews with your stakeholders. All the people who are involved in that particular kind of a problem. A lot of interviews, a lot of surveys. All these kind of statistical data gives you a lot of research-based proof that what exactly is the problem, validation of the problem, and pain point of the problem. So where you can actually work into. Invent is the phase where you actually start using your hands, your creativity, your design thinking skills, where you actually develop concepts, you develop a lot of solutions to solve as problems for your patients, or for whoever is having that kind of a problem. And implementation is when you actually start commercializing. You develop a strategy. Okay, I've made this kind of a product, or I've made this kind of a project, but how can this thing reach my patients? How can this be put into practice? How can I implement this into practice? And then how can I even create a commercial scaling, a commercial viability for this entire thing? That's where you go for implementation, and you create a business plan out of it. That's what you create. Innovation, right? Innovation is invention plus commercialization, and that's where you create that kind of a thing. And many kinds of organizations have given these kind of formulas for innovation, what kind of acronyms you can use. This is also one of the it's the same principle that goes with Stanford Biodesign, but with a different kind of an approach, where you do the 4Ds. Define unmet clinical needs. What are the needs? First define that through research. Design prototypes, implementation, inventing devices, create prototypes, create mock-ups, start doing even real world technology stuff, then go and test it to your bedside. Go and see how it works. Then you come back. So many times it's not necessary that whatever you make in the lab is always great. You go to the patients, you understand probably this is not what was required. You come back, rework and change it, improve it, and then you can get something, a better version, right? And then of course you always create a commercial value, so that the last D is for deploying it into the market. And these kind of technologies or these kind of tools have always been gifted to us by various organizations. We have also built our tools. Principles are same, but just the words and the usage is different. Brainstorm and ideate, empathize and design, prototype and test, deliver and deploy. That's what we do practically with all these students. These are real images. They are not Google images. These are real images where our students are working on these kind of problems in our lab at JJ Hospital, and started to even work with patients closely to solve these kind of issues, and how can they help the patients. And we also play an active role in teaching them that what exactly these kind of things can help you do. And of course it's basically a teamwork that happens, right? But when I'm talking about innovations, that doesn't mean that I'm talking about huge machinery like robotics, or a huge MRI machine that is one of the most complex instruments on probably in till now in the medical world, right? I'm also talking about how innovations can be as simple as possible, from the very ground level stuff and from the very basic stuff which a doctor can use, right? So a stethoscope, many times I feel that I guess you all can relate to this particular problem that a stethoscope has. Is its sound is very feeble, you can't hear it very well. Sounds of the stethoscope can't be recorded. So if I'm hearing a certain kind of a heartbeat, it's abnormal. I want to go back and in my room I would like to hear it. Is there any device that can record that sound? It's a mechanical vibration that's coming from a person's body, right? It's coming. How can you record that kind of a thing? you know Also, if I want to share the sound to somebody else, how can I record and share it? How can I see a graphical visual representation of the same sound, right? Mechanical waveforms can be put into graphs, but how can I translate this into that, right? uh, Frequency, how can I bring that frequency of the sound, and how can I see that heartbeat per second, right? This is all these kind of problems came, and that's how one of the companies, again a cross-disciplinary collaboration team, this is a startup from IIT Bombay, where two engineers combined with a cardiologist and identified these kind of problems, and they said, okay, let's make something like an electronic amplifier that can just be attached in between the earpiece and the diaphragm. And you can actually, this electronic device can basically do all the recording. It can give you translation of data, it can save data, and interpret data as well, even if you make it more smarter. And you can even amplify the sound, because the stethoscope sounds are very feeble. So this sound has an amplifier, this electronic device has an amplifier. The website is given, www.iudevices.com. I would request you to go and visit this website. You can learn more about what exactly this instrument does. They've also created a mobile phone application, an Android app for Android and iOS app for this particular device, where you can connect and you can record these data. You can record the sound, you can see the visual waveforms, PCG, a phonocardiogram. You can share it with different people on WhatsApp, and all these kinds of features are available on this particular product with an application, right? So many these kinds of innovations are there which are playing an active role. I think because of lack of, I think we'll go ahead with other concepts. I think how much time we have? We have about 10 minutes, I guess.
Yes, sir.
Yeah, we have about 10 minutes, right? So I'll just quickly brush through what exactly is entrepreneurship, because I think that was also one of the relevant questions that had come. That what exactly is entrepreneurship, and how can they choose innovation as a career option. So entrepreneur is, of course, the term states that a person who sets up a business, or he develops a business taking a financial risk in hope of profit. Why do you think that entrepreneurship can be a great impact? Because it is a great step towards the development of the country. This is something which we practically realize even during this COVID-19 time, when we hear from the government, when so many imports were stopped, right? We couldn't import stuff from foreign countries. Therefore, we had to develop everything in-house or inside our own country. We all have those kinds of skill sets, but unfortunately, we are exporting all our skills to different countries outside, to the foreign countries. If we use those skill sets and build our own initiatives in India, we can then grow and contribute to the development of the country. It becomes very, very nice when you actually start innovating, and then you start becoming even an entrepreneur, because entrepreneurship doesn't teach you just about running a business, but it also teaches you different kinds of all-rounder skills. So you are not a technical person who just builds your products and sells it, but it also about the art of managing people, the art of handling situations and during crisis, the art of selling, the art of handling finances. It teaches you different kinds of skill sets, and of course you can learn to earn and grow together, because it's not just that you're going to make money, but you're going to immense amount of learning you're going to get out of it. And of course, India is thankfully supporting this kind of mindset nowadays, and it has launched the Startup India initiative by the government of India. And it's not that many times we see that probably India में jobs कम है, jobs नहीं है, but entrepreneurship can open up much more opportunities, right? See, now restaurants were there, but to create a chain of these restaurants and to connect them to the user, now this thing has been done by Swiggy and Zomato. But if you see, because of starting this initiative, it has started giving a lot of jobs to people. Now, so many kinds of Swiggy and Zomato delivery boys have started coming, right? So many jobs have been given. Now, to run the app, give constant updates to the mobile phone application, to the entire website, there's an entire team who's sitting in Bangalore, who's doing that. So Swiggy, Zomato have their own companies. Their people are putting their vision. They're trying to see how can more and more customers be attracted towards it. So it enables a lot of job opportunities that can be created through entrepreneurship. And of course, it challenges the different kinds of challenges that is there in this today's nation. It can bridge that gap and it can solve those problems. So business is not just about selling things, it's also about solving problems and things that your customers need, right? So if we've written these things very detailed in our website, you can go to our website www.myslabs.in. We've written a detailed article that what do you need to know about medtech startups, because medtech startups are a little bit different from what it goes from other startups. But yeah, principles of those things remain same. And there are a lot of students who are starting their own companies. We are mentoring them, not just us, many other organizations, incubation centers are mentoring. A lot of students are coming with great ideas to start and to run companies, right? This is also one of the body that is coming under the Make in India initiative. It's known as the AMTZ, Andhra Pradesh MedTech Zone. So the government of Andhra Pradesh has launched, or has built a huge campus of medical devices manufacturing unit. It's based in Visakhapatnam, Vizag, in Andhra Pradesh. So it has created that kind of an impact where people can actually go and do their experimentation and research and even manufacture these devices at a mass scale. And it's a complete research hub that is based, and many such kind of plants have been coming. Many kinds of such innovations or organizations are coming to facilitate medical innovations. Let us talk. I'll just quickly summarize on how MySlab can facilitate and what all things we do. We have basically a 4-point agenda: training medicos, identifying needs, identifying unmet clinical needs basically, and driving medical innovations. We help students, mentor them, nurture them, and help them to build these kind of devices through interdisciplinary collaborations. Entrepreneurship, we help you understand the basic fundamentals and principles that go behind entrepreneurship, right? Um, we have also done small projects. If you can quickly see, bedwetting alarm. It's a small electronic device that creates an alarm when the patient has wetted the bed. Palsy gloves for cerebral palsy patients. This is a small bend sensor that basically can help the patient do automation on the room. You can control the room functions and controls. Um, then we also have emergency alarms based not based upon a switch, but also based upon gestures, moving beds. This is something which we had come before the COVID-19 times, contactless temperature sensor, and we had tested this even in JJ hospitals wards, and compared the readings. We've done some studies upon the infrared thermometers. Uh, we also have something built for skill building. CPR is a very essential skill. I guess Medicrew might have been organizing CPR sessions or something like that. And what happens is you do CPR on the mannequin, but you don't know that whether you're doing it effectively or not. Therefore, what we did is we opened up the mannequin and we put small electronic sensors that basically calculate the compression rate, and it gives you your efficiency through a mobile phone application. It shows that are you pressing full compressions. It gives you a performance based analysis and result, and it tells you whether you're doing CPR in a correct way or not, right? And these kind of many kinds of projects we have been doing, and we are doing a lot of things even during this COVID-19 times. We're working from home, but we're still working on these kind of projects to facilitate a lot of innovations and bring a lot of products and startups today. And okay, now the main question comes: I've understood about innovation, how can I participate? We conduct, the first and foremost thing is how can we start building that bridge between engineering, medical, and design institutes, because all of them are different things. They teach different things, but if we can bridge all of them together, how can we do that? That is something which we are working upon, and we are trying to build that kind of a bridge. You can also attend our courses, workshops, and innovation. It's basically based upon building your process, innovation process, and design thinking, the entire 4D formula which we do. And it's not just theoretical, but we do it on practical. Uh, and yes, so as I mentioned, you can start working, you can do research, ideation, develop your devices, create teams, form together, come together, identify the like-minded people amongst you all and come together as a team. You can start writing papers, do research and write papers and publish them in medical journals. You can also apply for research grants. ICMR has the STS short-term project. It is also offering stipends or grants for people who want to innovate, and they give that kind of a research grant. BIRAC is also one of the leading organization that's coming, which is offering a lot of grants for students or any researchers who wants to develop their innovations. And yes, patents are always there. You have an idea, you want to patent it, you can definitely go for it, patenting your ideas. We also do a lot of hands-on workshops. That's what I mentioned. So we teach our students not just by theoretical, we teach them how to use these kind of tools to develop something useful. Of course, other than that, we also do one-on-one training sessions and theoretical training sessions where we teach them about these concepts. We also do something that's known as a hackathon. It's really fun in this hackathon where we bring all different kinds of people. So there's one team that's formed. Different teams are formed, and every team will have an engineer, will have a designer, will have a medical student, will have somebody from MBA, somebody from the marketing and commercial fields. Sit together. Every team gets a problem statement. They actually build, by the end of one day, they actually come out with some practical solution, and they actually build a prototype, a small mock-up of what exactly their concept and idea is about. And it's really fun to interact with different mindsets coming together. Like we are doing this webinar online. We have started this even online, going online to do these kind of workshops, webinars, boot camps. This is the one which we had done with MSCI. I think this was last month, I guess we did, and it was a lot of participants. Again, we had a lot of fun. We teach them concepts, and of course we have a lot of interaction. and we have a lot of long-term goals. We want to create a curriculum that which I mentioned previously, that there is no a college or there is no curriculum that is there which can be inculcated in your medical curriculum, in your MBBS curriculum or physiotherapy curriculum, whatever medical this thing, and which teaches about medical innovations and entrepreneurship. We are building that curriculum. We are also doing a lot of partnerships with Stanford Biodesign. We're trying to build that global connect with world class organizations. We also want to partner with a lot of student organizations like you and conduct more and more innovation programs, be it online or offline, physical level. We are also trying to build a medical innovation community. Right now, we are trying to do it digitally, to build a social media community where people can start following our social media handles. We are there on Instagram, Facebook, LinkedIn, and we keep posting daily stuff. We keep posting about different kinds of medical innovations that happen. We also want to start a lot of mice labs in different kinds of medical colleges, and in the future we would like to incubate and nurture student startups by even offering them grants for their research and helping them to get funds to develop their own product and to start their own company. In short, I just want to conclude to say that there are a lot of possibilities in terms of innovation and whatever. The only thing, this is a very nice quote which I like by Arthur C. Clarke, who says that the only ways to discover the limits of the possible is to go beyond them into the impossible. And with that note, I conclude today with this session. And these are our contact details, our email ID, website, social media handles are there. You can connect to us on either of these platforms. We are always available. I'm even sharing my contact number. This is the official contact number for Mice Labs. You can take a screenshot if you want, or you can stay connected to Rotaract Club of Medicrew. We'll be anyways be connected with them, and on a long-term relationship, we'll be sharing all these kind of resources and training sessions with all of you, and hoping to see a lot of healthcare transformation happening by all young enthusiastic medical students. Thank you so much for patiently listening.